A new social media trend targeting young people is taking over TikTok. Instead of a popular dance, people are misusing over-the-counter medication, Nyquil. News Channel 3's Tatum Larson is live here in studio with the latest. And Tatum, tell us more and why it's a dangerous trend.
Hi, Karen. The FDA is warning against a new TikTok challenge called the Nyquil Chicken Challenge, which involves cooking chicken in Nyquil. The agency is saying that in addition to this being a not tasty way to eat chicken, it's also extremely dangerous.
TikTok is the home of popular trends, but a new one called the Nyquil Chicken Challenge prompted the FDA to make a public statement. They are warning you don't even have to eat the drug-soaked chicken to suffer the consequences of cooking the medication. The FDA says boiling a medication can make it much more concentrated and change its properties in other ways. Even if you don't eat the chicken, inhaling the medication's vapors while cooking could cause high levels of the drugs to enter your body. It could also hurt your lungs.
What it is that they're doing that they think is a joke and how quick it can go wrong.
Although kids often fall prey to these dangerous trends, mental health professionals like Palm Desert therapist Satish Reese say there is something you can do to try to keep them from participating in them.
It's important to have a open line of communication with your kids. Also about the seriousness of this challenge. Speaking with your kids about the dangers of the misuse of drugs, especially those spurred by social media.
The FDA says parents can also keep OTC and prescription drugs away from children and lock up these medications to prevent accidental overdose.
Now, this is not the first time the FDA has had to alert people about social media trends. You may recall the Benadryl challenge from the fall of 2020. There were reports of teens being taken to emergency rooms and even dying from sharing videos over medicating with the cold medicine. Live in studio, I'm Tatum Larson.